Hi everyone, my name is Hipkeo. Today I'll be presenting Aging H, an innovative AI-powered wearable device designed for chronic disease management. Our goal is simple: deliver continuous personalized care at a low cost while improving outcomes for patients with chronic conditions. Chronic disease is one of the most expensive and deadly health challenges today. In the US alone, over 843,000 people die annually from heart disease and stroke. Chronic conditions account for about 90% of health care spending. The real issue is that care today is reactive. We wait until patients get worse instead of preventing deterioration. And this solution is possible now because of three major trends. First, FDA has rapidly approved AI enabled medical devices. Second, wearable technology has become more accessible and affordable. And third, um, healthcare is shifting toward value-based care. Together, these create blue ocean opportunity for proactive chronic care. And our vision is a world where no chronic disease patient deteriorates unnoticed between visits. So our mission is to deliver continuous monitoring while protecting patient privacy and aligning with healthcare system like United Health Group to improve outcomes and efficiency. So the traditional model focuses on insurance coverage, claims processing, and episodic care. It relies heavily on provider networks and reactive treatment rather than prevention. Um, the revised business model, uh, our model shifts to continuous AI-driven chronic disease management. We use predictive algorithms to identify risk up to 10 days in advance and intervene early. We also expand customers to include providers and external organizations, just not just patients. The biggest shift is moving from reactive insurance-based care to proactive, continuous care. We also introduce new revenue streams like provider licensing and strengthen direct patient engagement. Our value proposition is delivering affordable, personalized care supported by insurance integration. We also align with value-based payment models, focusing on outcomes instead of volume. Uh, our biggest advantage is access to large data sets and patient populations. This allows us to improve predictive accuracy and prevent costly hospitalizations. Ultimately, we extend care into patients' daily lives with real-time monitoring. Uh, and we plan to start with pilot programs and partnerships, then expand nationally and eventually globally. Our strong clinical data-driven foundation supports scalable, growth. There are risks, including high initial cost and evolving FDA regulations. However, the opportunity is significant. Lower healthcare cost, better outcomes, faster adoption of value-based care. At this stage, there are still key assumptions that we need to validate. First, customer adoption. We are projecting about 1.5% in year one and 3% in year two, which will be tested through pilot programs and A/B testing. Second, profitability. We are targeting a 70% gross margin, supported by a cost tracking and vendor optimization. And third, engagement. We aim for about 70% sustained member engagement, which will be validated through user analytics and continuous product improvements. Our platform represents a major shift from traditional chronic care. Instead of relying on occasional visits and patient self-reporting, we use continuous biometric data from wearable devices. This allows us to move from retrospective analysis to real-time predictive analytics, identify risk up to 10 days in advance. Most importantly, care becomes proactive instead of reactive, and patients become more active participants in their own health. Um, This innovation is supported by its strong organizational capabilities. We already have advanced data analytics, infrastructure, experienced clinical teams, and direct relationships with millions of members. In addition, our regulatory expertise and financial strength allow us to implement and scale these solutions efficiently. Um, For target segments, we focus on three key segments. First, Medicare Advantage patients with chronic conditions. This is our primary target due to high need and high cost. Second, commercial patients. Which we plan to expand into year two. Um, and third, external provider organizations. Where we can license the platform as a long-term growth opportunity. Um, So our typical patient is between 65 to 85 years old, with multiple chronic conditions and recent healthcare utilization. Most are motivated to maintain independence and avoid hospitalization. Our strategy is to reduce unnecessary visits, lower costs, and empower patients through real-time insights. Um, Create a more effective and patient-centered care model. In the first 24 months, we project over 500 million in revenue across Medicare Advantage, commercial plans, performance-based incentives, and provider licensing. With a 45 million initial investment, we expect 181 million net income in 24 months and ROI of 150 to 200% within 3 years. Um, um, Our model achieves a strong 70% gross margin with control operating costs and scalable growth potential. In conclusion, H&H transforms chronic care from reactive to proactive by combining AI, wearable technology, and value-based care. We improve outcomes while reducing cost, creating value for both patients and the healthcare system. And thank you for listening. Here are my references.